Hi everyone, I'm Natasha. I'm a principal clinical psychologist from Us Therapy, and today I'm going to talk to you a little bit about ADHD. All you parents out there, have a good listen. Few topics stir as much debate and confusion as that of ADHD, especially among parents trying to do right by their children. Worries about overdiagnosis, medication, pathologizing normal childhood behavior, the concerns are never ending. A recent New York Times article reignited public discourse. The article was entitled, "Have we been thinking about ADHD all wrong?" But as psychologist Emily Edlin points out, it missed the mark in several critical ways. It's time to set the record straight. So to be clear, we're not defending a diagnosis. If you're a parent concerned about ADHD, your concerns are normal, valid, and healthy even. So upon receiving a diagnosis of ADHD, a lot of parents wonder, will this change how others see my child? Will medication dull my child's spark? But in the noise of the debate, the most important voice often gets lost, that of the child who is struggling. Therefore, we want to cut through the noise. We want to help foster an understanding of ADHD, what it is, what it isn't, and how we can better support the children and families navigating it. The ADHD diagnosis is more than just a checklist. The first thing that needs to be understood is that diagnosing ADHD, it doesn't involve just a quick quiz or a one-off observation. It is a comprehensive and thorough evaluation conducted by a skilled clinician designed to rule out other causes that might mimic symptoms of ADHD, such as trauma, anxiety, or other learning disabilities. It considers the child's developmental history and draws from multiple sources of information such as parents, teachers, and other treating clinicians. It aims to identify both challenges and strengths across all settings, be it home, school, or social settings. Misdiagnosis is real, but so is underdiagnosis, especially in girls, marginalized communities, and those whose symptoms do not fit the typical hyperactive stereotype. So medication is just one tool in the toolbox. Perhaps the most heatedly debated topic in the realm of ADHD is that of medication. It's time for a reframe. Medication is not a cure. It is a mere tool, albeit an effective one, to be used as part of a broader treatment strategy. Fact: studies have shown that stimulants reduce core ADHD symptoms in 70 to 80% of cases, and are linked to 19% reduction in premature death due to risky behaviors reduction. Another fact: medications work best when paired with other supports such as behavioral therapy, parenting strategies, school accommodation, and environmental adjustments. So an effective treatment plan is comprehensive, enabling the child to build core regulation skills, supporting parents to learn effective strategies, and facilitating schools to make simple classroom changes for the neurodivergent child. The next debate that's also quite contested in this area is that of the environment and biology. The nature versus nurture debate dichotomizes the etiology of ADHD as being either a real brain disorder or the result of a fast-paced, screen-saturated modern environment. Yes, environment absolutely plays a role. Stress, sleep, nutrition, parenting styles, and increasingly technology all influence behavior. But it's also important to remember that ADHD is a well-established neurodevelopmental condition with strong genetic links. It's about how the brain regulates attention, impulse control, and executive function. The environment inevitably interacts with these brain-based differences, but it does not directly cause them. So then the question really isn't whether ADHD is real or not. That shouldn't be the debate. The observable symptoms, for instance, difficulties focusing, emotional dysregulation, impulsivity, are undoubtedly genuine. The homework battles, the social friction, the emotional meltdowns, these impact daily life and functioning. Let's shift the focus to asking, how can we help? Diagnosis should not just be about labeling. The ultimate goal of a diagnosis is to improve your child's daily life. It should support unlocking access to different types of support, strategies, and resources that improve long-term outcomes, helping your child not just cope, but thrive. So ignorance isn't bliss when it comes to ADHD. While parents are justifiably worried about the risks of treatment, we must also acknowledge the hazards of untreated ADHD, which extend beyond the academic realm. They have emotional impact, relational impact, and even physical impact. Adults with ADHD live, on average, 7.5 years less than a neurotypical peer. Emotional dysregulation, poor impulse control, and executive dysfunction can impact careers, relationships, and overall well-being. Data also shows that appropriate stimulant medication is associated with a 19% lower risk of premature death, largely by reducing the impulsive and risky behaviors that can lead to harm. Another area of concern usually lies in overdiagnosis. Concerns about overdiagnosis often miss a key detail. Half of adult ADHD diagnoses happen in adulthood itself. What looks like a surge in diagnosis is often a catch-up, especially for women and girls who were overlooked in childhood. For generations, women and girls who often present with inactive rather than hyperactive symptoms were missed. They were not false positives, they were delayed recognitions. This means that diagnoses today represent progress in assessment and evaluation, not just trend. So the quality matters. Parents, you have to take note of this. A rushed 15-minute appointment is not a proper ADHD evaluation. A thorough assessment often spans multiple sessions, includes standardized tools, and gathers information from various sources. If you are a parent concerned about your child's attention, behavior, or emotional regulation, here's what you can do. First of all, start with questions. Ask your pediatrician or psychologist about comprehensive ADHD evaluations. What does your evaluation process include? How do you rule out other conditions? What supports do you recommend beyond medication? All these are very key questions that you should ask them. Secondly, look for quality. Seek providers who offer assessment across multiple sessions and collaborations with schools. Explore supports. In other words, medication is only one mere option. Behavior therapy, parenting support, and school accommodations make a difference too. Lastly, stay curious. ADHD is not a verdict. It is a doorway to understanding as well as to support. ADHD is complex, but our response does not have to be. Navigating ADHD is a journey, not a single decision. By focusing on a systematic process, a comprehensive intervention plan, and your child's unique needs with compassion and clarity, we can move beyond the fear of a diagnosis towards embracing meaningful support. So if you are navigating concerns about your child's attention, behavior, or emotional regulation, know that you're not alone and you don't have to figure it out in isolation. Here at Us Therapy, we offer a thorough ADHD assessment, grounded in best practice standards. Our team is dedicated to providing the comprehensive, multi-session evaluations that form the foundation of true understanding. We go beyond the checklist to see your child's unique strengths and challenges, ensuring an accurate picture that rolls out other causes. Our goal is very simple: to help your child thrive, not just survive. Reach out today to begin a journey of clarity, compassion, and empowered support. Thank you.